We're now joined by Dr. Kathleen Neville, who is Associate Dean, Graduate Studies and Research, College of Nursing, Seton Hall University. Good to see you, Doctor.
Thank you. Thank you for inviting me.
Let's talk about the role of nursing, the role of nurses in the age of COVID. How much has it changed and how much more important is it today than ever before?
Okay, I think I could talk about 45 minutes about that.
Yeah, right.
But it's dramatically changed everything. It's, COVID has wreaked havoc. This is a pandemic that the last one was in 1921. Ironically, the World Health Organization announced that 2020 was a year of the international nurse and midwife.
That's
and
right.
it really was in recognition, and the International Council of Nursing, it really was in recognition for society to really recognize the value of nursing. Because the World Health Organization, I think, estimates there's going to be an incredible worldwide shortage of nursing. So it was supposed to be a celebration, and it was really to highlight the value that nurses have in improving the world's health. And ironically, I think we've done that with COVID. What nurses have endured, hopefully in New Jersey, at least, it has really leveled off, but it's been extremely challenging. They were at the front lines. Nurses are the ones who spend the most amount of time with the patient. Repeatedly, Gallup poll says they are the most trusted and valued. And I think what we've seen in the news, has really highlighted the value and importance of nursing. I've never been more proud to be a nurse.
Do you think, Doctor, that given the difficult times that nurses are facing, the need for better and more PPE, et cetera, the long hours, the stress, the seeing people suffering, death, et cetera, do you think it's going to be harder for people to choose to go into nursing?
Okay, so when in March, when the pandemic hit, I thought, oh wow, what's going to happen to enrollments?
Right.
Remarkably, because nurses really are very altruistic. Remarkably,
Sure.
Nationwide, we've seen an increase in enrollment. We have more graduate students coming in this fall than we did last year. So, it could have gone two ways. It could have said, I thought, uh-oh, what's going to happen? No, it's really, I think it's highlighted the heroism and just nurses don't do it. My mother says, people are going into nursing because of the salary. You never go into nursing because of the salary. Yeah. It's too difficult and challenging a job.
Clearly. By the way, there's a federal grant that you and your colleagues have gotten. But let me also disclose Seton Hall University, one of our higher ed partners at the Caucus Educational Corporation. You got a federal grant dealing with opioid use disorder, right?
Yes.
What is it and why does it matter so much?
It is so important. Now we have a collision of a pandemic, and the opioid epidemic has been mounting and mounting. This all started in the 80s with the, more effective pain management. But the opioid epidemic before COVID, has killed more people from recent wars, violence, motor vehicle accidents. So we wrote this grant, and we're very proud of this. It is a wonderfully interprofessional initiative. So we moved Seton Hall, the College of Nursing, and the School of Health and Medical Sciences in May of 2018. And I really retired from a state position and then took this position as Associate Dean at Seton Hall because of the wonderful opportunities for interprofessional education. So we moved to the Nutley, the former Roche Pharmaceutical campus, and we weren't even unpacked, and we started writing this grant to address the opioid epidemic, to combat it. And basically what it is a 3-year grant. We're in our second year. It'll end in September, and we have our last year. It'll end in 2021. Basically, what the grant is, we designed a curriculum, embedded curriculum. It's going to be sustainable for all 3 schools. We can no longer teach in silos anymore. Healthcare demands that we're together. So what this opioid grant is, it's to educate nurse practitioners, medical students, and PAs to be able to prescribe medication-assisted treatment, because 80% of people do not have access to MAT. And
Wow.
that's the sad thing.
Dr. Neville, when you come back next time, we'll do an update on where the nursing profession is, what's happening at the School of Nursing, also an update on this federal grant. But I want to thank you for joining us. And on behalf of all of us who appreciate the work of nurses now more than ever, not only should 2020 be the year in nurse, every year should be. Thank you, Doctor.
I couldn't agree with you more. Thank you.
You got it. I'm Steve Adubato. We'll be right back.
Think Tank with Steve Adubato has been a production of the Caucus Educational Corporation. Funding has been provided by Johnson & Johnson, TD Bank, New Jersey Sharing Network, PSC&G, the North Ward Center, the Russell Berry Foundation, NJM Insurance Group, the Fidelco Group, and by the Adler Aphasia Center. Promotional support provided by AM 970 The Answer and by NorthJersey.com and Local IQ, part of the USA Today network.
The essence of the North Ward Center is ingrained in our values, thoughts, and actions. What began as a storefront on Bloomfield Avenue has evolved into a life-changing community nonprofit. The mansion is steeped in tradition, but with all of its grandeur, the true essence of the North Ward Center is in the people we serve. So as the North Ward Center commemorates 50 years of service, let's also celebrate the many opportunities yet to come.